What is plantar fasciitis? Have you been having some kind of foot pain and maybe you've talked to your friends and your family and they're like, oh, that's plantar fasciitis. Or maybe you went and saw an orthopedic doctor or a podiatrist and told them about your foot pain and they were like, oh yeah, it's plantar fasciitis. And you're like, what is plantar fasciitis? Well, I'm Dr. Amy with Physical Therapy for Everybody, and today we are going to talk about plantar fasciitis and exactly what it is and what that means for you. Our goal at Physical Therapy for Everybody is to help you to be able to live an active, healthy, and confident lifestyle without needing injections or surgery. And I got to tell you, plantar fasciitis is not necessarily one of the easiest things we treat, but it is definitely one of the most treatable things that we treat. In fact, right now in the clinic, we have probably 5 patients who are suffering with plantar fasciitis. We can't quite figure out why. I'm assuming probably that people were a little bit more sedentary with the COVID and all that. So I'm assuming that that's the problem and that that's why we're seeing so many cases of it right now. But I've treated hundreds of cases successfully of plantar fasciitis without needing injections or surgery or even any medication. So let's talk about what plantar fasciitis is. Technically, what it means is an inflammation of the plantar fascia on the foot. So let's break that down. First thing, what is fascia? So fascia is the layer that normally kind of helps, it's like the sausage casing kind of in your body, okay? It kind of helps hold everything together. Now in your body you have certain specific areas of fascia that are really, really thick. Maybe you've heard of the IT band, the iliotibial band. That's one of them. It's a really, really thick piece of fascia, so it has a special name. Plantar fascia is the same thing. It's a really, really thick piece of fascia, so it has a special name. And it's found on the bottom of your foot. Now, it starts from your heel. So most people will have pain on their heel first. And then as the plantar fasciitis progresses, the pain will spread and follow the plantar fascia down to the toes, right? So all of that makes sense. But why is it so common? Well, there's a lot of joints in your feet, all right? There's a lot of different bones and they gotta absorb stress from the bottom up, so from the ground up through your spine, and also deal with your body weight walking across the surface, the floor, outside, running, all that stuff, right? So the plantar fascia is particularly important because it creates, it's called the windlass effect, but basically it keeps your foot together while you're walking, running, jumping, all of those things. It makes sure that all of those joints work correctly, which is kind of a big job when you think of all that weight from above and all that force from below, and all those joints have to move correctly in order to allow the plantar fascia to do its job correctly. So you can see why people have a lot of problems with the plantar fascia, because it's a really important structure that gets stressed basically every time you're standing or walking or running or jumping, and it takes a lot of load. So that's why we see plantar fasciitis happening so often, especially when people have been less active or when they have jobs where they have to stand for prolonged periods of time. So right now I'm seeing a lot of teachers who are standing right all day long, and they're having a lot of problems with their plantar fascia. So prolonged standing is definitely one of the things that can put increased stress through the plantar fascia. Another thing is if you have really, really high arches, so then the plantar fascia naturally is a little bit shorter because you have this really, really high arch. So then the plantar fascia, which is this line that goes across the bottom of it, is going to be shorter. So especially when you're doing high impact activities with high arches, so if you're running or jumping, it definitely can put more stress on the plantar fascia. Now, not necessarily everybody with high arches has plantar fasciitis because this tissue can adapt over time. So if you slowly progress into running or jumping activities, the plantar fascia is able to adapt to it. But if you've recently taken up running or jumping and you have high arches, that can cause plantar fasciitis. The opposite is also true. If you have really, really low arches, the plantar fascia is already really long, and then you start a high intensity activity like running or jumping, and there's more stress put on the fascia, and the fascia's just like, dude, like, no, I'm out. I tap out. That's all there is. I'm going to cause pain to get you to stop doing this. Again, even with low arches, you can adapt over time, but if you start an activity rapidly, it can cause pain to that plantar fascia. Something else I forgot to mention earlier. The fascia does not have a great blood supply, and the feet are the farthest area from the heart. So that's another issue and reason why people have so much problems with plantar fasciitis is the blood flow is just not the greatest there. You know, you think of if you have like a pec strain or something like that. Well, I mean, it's big muscle, lots of blood flow, really close to the heart. Those tend to resolve pretty quickly on their own. But when you're dealing with a plantar fasciitis, it's so far away from the heart, it doesn't have that great a blood supply anyway. It definitely can be a problem that can drag on for a long time. And like I said earlier, it'll just spread and it'll get worse as it heads down to those toes because it's taking up that whole plantar fascia. One of the big things I see with people who have plantar fasciitis is that they are wearing shoes that are not supportive. So I know that your flip-flops may be super, super comfortable, and I know that you may really, really like wearing your Keens, but those shoes are not supportive. And especially my friends who have high arches or low arches, I'm looking at you guys. If you're gonna be standing or walking for a long period of time, you have got to be supporting those arches. I mean, just think about it. If you're standing for a long period of time and either they're high or they're low, it's going to put a lot of stress through that plantar fascia if it's not supported. And the thing is, when you're standing for a long period of time, the muscles kind of shut off after a while. They're like, oh, okay, you don't need me? All right, I'm going to tap out. So they're not helping to support, which means all that force is being put through that plantar fascia. So if you're going to be particularly standing for a long period of time, but even walking for a long period of time, and you have high arches or low arches, you really need to be wearing supportive shoes to make sure that that arch is properly supported so you don't have increased stress to that plantar fascia. All right, we already talked about running and jumping. Those definitely put increased force through the plantar fascia, and I'm not saying you can't do it. I don't recommend doing it if you're having plantar fasciitis symptoms, but it's not like if you have high arches, you can't ever run. You just need to progress into it. So with people who want to get into a running program who have high arches, I definitely recommend you start with a regular walking program and then you do some intervals. So if maybe you want to be able to run for 30 minutes, maybe that's the goal. Okay, then you want to start walking for 10 minutes, increase 15, 20, 25, 30. And then when you're walking for 30 minutes, you want to do intervals. So walk for 4 minutes, run for 1, walk for 4 minutes, run for 1, and then start increasing your run time until you progress to running for 30 minutes. It takes time. You've got to give your body a chance to adapt, or else it will rebel and it will cause symptoms like plantar fasciitis. So I definitely recommend only changing one aspect per day. So if you're trying to increase if you're walking, you're trying to increase your time first, get to the time you want to be at, and then start changing those intervals so you can add in that running. Okay? Don't try to change things too fast. Give your body a chance. It has to remodel, it has to get used to it. I promise you, although it's frustratingly slow sometimes, the outcomes will be better because you won't be sidelined due to an injury. All right. We talked about prolonged standing. I mean, I'm not a fan of prolonged standing, like for anybody. Definitely if you're having plantar fasciitis symptoms, you need to take a load off. You got to give those dogs a break, all right? Try to find a way that you can sit intermittently, even if it's just for 5 minutes, you know, like if you're a teacher and you're up and you're on your feet, even if you can just sit, even perch for like 5 minutes, it will help to take some stress off and will alleviate some of the symptoms of plantar fasciitis. Another group of people who we often see plantar fascia symptoms with is our friends who are pregnant. So you have the double whammy in the fact that you have increased weight and you also have relaxin going through your body, which is relaxing all of those ligaments and the fascia. Yes, friends, I do feel you. I definitely do. And I know that it's really, really tough because you still got to get up and walk around and do your things. So with our friends who are pregnant, we definitely have some exercises that we can give people and stretches and some self-care techniques. Hopefully that will resolve after the baby's born individually, but we definitely recommend implementing those techniques while you're pregnant and after you're pregnant to make sure that everything does resolve without any issues, because we definitely don't want to have it continue after pregnancy, right? It's just, you got enough to deal with after you have a baby. You don't need to deal with your feet hurting too. All right, the last group of people that we tend to see plantar fascia symptoms with is those who are obese, which makes sense. If you have more weight pressing down on that plantar fascia, it is going to make it more challenging, right? You may have noticed if you were pregnant previously that maybe you had symptoms then, and that was probably due to the increased weight and the relaxin, right? Same thing happens when you're obese. So there are still things we can do. Don't feel like I'm saying, if you're obese, you're just going to be stuck with plantar fasciitis. No. That's not what I'm saying at all. There are definitely things we can do. There are exercises, there are stretching, there are self-care techniques, just like our friends who are pregnant, that we can do. And I have successfully eliminated plantar fasciitis symptoms even in people who are obese. But it definitely, the extra pounds are more of a challenge as your body remodels to adjust to them. So we got to take that into consideration and realize that we're going to have to work a little bit harder to help those tissues remodel, which might make it take a little bit longer to deal with. However, I do want you to know that there is hope and you do deserve to be able to walk pain-free. And there are things that we can do to help you with your plantar fasciitis. So our next video is going to be all about that. It's how to diagnose plantar fasciitis as well as how to treat plantar fasciitis. So go check out that video on YouTube and I'll see you later. Have a great day.